Welcome back. The time is now 7:46 and today is National Wear Red Day today. It's a day where we wear something red to show support and raise awareness for heart disease. You can see all of us with our red on, even Nick with his little red handkerchief rather. Well, there's an interesting statistic, and according to the American Heart Association, heart disease is the #1 cause of death of women in the United States. So what do you need to know to protect your heart health? Well, we have Dr. Renee Bullock-Palmer. She's a cardiologist at Deborah Heart and Lung Center. She's back with us this morning to give us some important tips. So good morning, Dr. Renee, and thanks for joining us.
Good morning, Demetria. Thanks for the invitation.
Of course. Well, there are a few myths that you said that you wanted to come onto the show to debunk today. We do want to get through those because a lot of people tend to believe that cardiovascular disease is a men's disease. But that statistic that I just mentioned, it tends to prove otherwise.
That's right. So February has been dedicated by the American Heart Association as Go Red for Women to raise awareness of heart disease in women. Heart disease remains the #1 killer for women in this country. So it's oftentimes thought that heart disease is a man's disease, but that's actually incorrect. Women fare just as poorly as men from heart disease.
And speaking of women, this doesn't just affect older women. I mean, it affects young women too, even those who are fit. So talk about why we should not just count on that one idea.
Exactly. So it's oftentimes thought that, I'm in my 40s, I'm in my 50s, I'm too young to be worried about heart disease. But in fact, that's not the case. For women, especially in their 50s, if they do present with heart disease, they actually fare worse than men. And I always tell my patients it's never too early to start thinking about heart healthy living. So even if you're in your 30s and you're in your 40s, you always have to think of maintaining a healthy weight, eating a healthy diet, minimizing alcohol and stopping smoking, all those things. It's never too early to start.
Well, in addition to those tips that you just mentioned, are there other things that we can do in order to keep our hearts healthy?
Precisely. So one of the things that I always impress upon my patients is that you have to think about your diet very carefully. Things such as trying to minimize your sodium intake, trying to minimize your carbohydrate intake, animal fats such as beef, pork. You really have to minimize that. Really trying to have a plant-based diet. And for your protein, if you have to have some protein, then chicken, a lean pieces of chicken, fish, fruits, nuts. So really a Mediterranean style diet has been shown to be effective in maintaining a heart healthy cholesterol level and a heart healthy weight.
And you say this as I'm planning my menu for the big game, and it's like chicken wings and all this fried foods. But yes, I definitely know we need to change it up and do something better. Well, we talked about the signs and symptoms of a heart attack before, but we do understand that they're different in both men and women. So talk about some of those differences and what should we look for?
Right, so it's oftentimes a myth that women do not present with chest pain, when in fact, women are just as likely as men to present with chest pain. Usually when I do get that history from my patients, I do not use the word chest pain. I tend to use the word chest discomfort, chest sensation, because oftentimes patients think, oh, I'm not having chest pain, I'm having chest pressure, when exactly chest pressure is a red flag for heart disease in women. With women, in addition to chest pain, they oftentimes have other symptoms like fatigue, shortness of breath, just not feeling well. And because of those other symptoms, oftentimes when they do present, it's perceived that they're not having a heart attack because the chest pain story gets smothered in other symptoms. So really, you have to have a very heightened awareness of that and impress upon your physician that you're just not feeling well, you need to get your heart checked. And if you're not getting answers, then seeking a second opinion is always the best thing.
And Dr. Renee, where can people go if they want to learn more about their heart health?
Right. So the American Heart Association has a very wonderful website that's patient-oriented. I always, stress upon my patients to visit that website. They have very wonderful heart-healthy recipes, heart-healthy types of living. So I highly encourage that. Of course, at Deborah, we do have our website and our webpage for patient education. And even if you're feeling well, I always impress upon patients that the Well Women's Visit is something that's very important, especially especially for women above the age of 40. So even if you do not have heart disease, it's always a good idea, even once a year or every other year, to get your heart checked, get your cholesterol checked, know your numbers, your blood pressure, all of those things, your glucose levels, very important.
Well, awesome information. I want to thank you so much for coming on Go Wear Red Day. Thank you so much, Dr. Renee.
Thanks so much, Demetria. Thanks for the invitation. Bye.
Well, up next.